Hey guys, welcome to another episode of the 4 Pillars of Health with Kevin Davis. Today we are going to talk about the dreaded word sugar. Sugar is all around us. It's on every corner, convenience stores, grocery stores, ball games, family get-togethers, church functions. Sugar is everywhere and is causing a major problem within our health system. And the amount of money that is spent on treating sugar-related problems is astronomical. But what we're going to talk about today is some of the things that can help you fight this sugar addiction. We're going to give you some signs of what it is to be sugar addicted. We're going to talk about things that are associated with taking an excess amount of sugar as far as our health. And then we're going to give you some pointers as far as like how can you detox and get off sugar. And one thing that we're going to do for the people who follow this is we're going to do a 5-day sugar detox challenge. So if you're interested in joining us, click the link and we'll get you set up. We'll get you some emails. We're going to have a couple of Zoom calls to answer questions and just to encourage you so that you can get healthier by getting off sugar. Now, the one thing with sugar, and this is surprising to a lot of people, and it's surprising to a lot of my patients and my clients, is the amount of sugar that we take in. Typically, it's not unusual for me to go through someone's food log and see that they're taking 100, 200, 300 grams of sugar per day. And you may be thinking, well, that sounds okay. How much should we take? Well, it's going to be surprising probably to you. You're going to see that for men, you're going to have a recommended less than 35 grams of sugar per day. Women is less than 25, and kids less than 12 grams of sugar per day. Now, just to kind of give you an idea how much sugar is in our system, regular 12-ounce can of pop. I say pop, you say Coke, you say Pepsi, whatever it may be, but average, it's around 40 grams of sugar per day. That's 40 grams. That's more than what anybody should have. You know, if your kids are drinking a couple cans of soda a day, you can see the detrimental effects it's going to have on their health as they get older. And I think that's one reason why we're having a lot of health issues in the United States. So what we want to do is get that down. We want to get it down to a reasonable amount. You can't really go zero sugar. I eat very little sugar, but I still take in 10, 15 grams of sugar per day because it's in our foods as well. But what we want to eliminate is the sugar that is kind of like the bad sugar, the high fructose corn syrup, those type of sugars that are causing the problems in our health system. So you may be thinking, well, I'm not sugar addicted. Well, let me ask you if you have any of these signs of sugar addiction. Are you hangry? And what I mean by that is when you get hungry, do you get angry? Do you get frustrated? Do you get short with people? If you've missed a meal, how do you feel? A lot of people who miss a meal, they think it's the end of the world. You know, if you're metabolically flexible, which I think I am, I can miss a meal or even 2 meals and I'm okay. So one of the signs being sugar addicted, it's just like if you're addicted to anything else, you go without it for a certain amount of time, what's going to happen is your body's going to crave it and you start behaving in a different way. So be honest with yourself. Are you hangry? Is that a sign for you to be sugar addicted? Another thing is your weight. Obviously, I think that's pretty obvious to a lot of people. But if you have a lot of especially central obesity, you may be sugar addicted. You may be taking in too much sugar and it's being stored where it should not be stored. Number 3, if you have rashes, if you have acne, those can be signs of sugar addiction too. You're taking too much sugar in. It's surprisingly how many times I've had patients come in. They come in with acne. They come with these skin rashes, eczema. We go gluten-free. We go dairy-free. And then we try to get them off sugar and it goes away. They don't have to take anything. Now, surprisingly, some people are so addicted to sugar, they go back to eating that and want the creams and things like that to treat it. Number 4, high blood pressure. A lot of people don't associate sugar with high blood pressure, but the inflammation that sugar can cause can make an elevated blood pressure. So, getting rid of sugar may help reduce your blood pressure. And then infections. If you have a lot of frequent infections, that could be a sign of you're taking in too much sugar and you're addicted to sugar. You may resonate with one, you may resonate with all. But the thing about it is even if you don't have any of these symptoms, you still are going to suffer some consequences from taking in too much sugar. So I really recommend that you track your sugar, see how much you're taking in, and get a real-time number as far as the grams you're taking in on an average weekly basis. Why is sugar bad? How does it affect us? Well, one thing is weight gain. I mentioned that before. A lot of it has to do with your insulin. Insulin is your fat storage hormone, meaning that if your insulin level goes up, your fat storage goes up. And what happens when you take sugar in? Your insulin level goes up. So it's our physiology physiology. You can't get away from that. And number 2, diabetes. It's an elevated blood sugar problem. Just think about this. If you have diabetes, the trouble with diabetes is taking too much sugar, which, a lot of times is simple carbs and things like that. So if diabetes is a sugar problem, if too much sugar, what would you think the obvious choice of treatment would be? And that would be to take away the sugar. You take away the sugar, it helps with your diabetes and can reverse your diabetes. Number 5, fatty, non-alcoholic liver disease. This is becoming so prevalent. I see it in kids young as 10 years old. We talked about how much pop is drank by kids these days. What do you think? Well, you think maybe fatty liver is not that bad? Well, it's becoming the leading cause of liver transplants. It used to, 40 years ago, if you had fatty liver, it was usually because you're an alcoholic, because we didn't have the sugar that we have today. So it's important that we understand that this excess sugar can cause many, many symptoms. Number 4, sleep disturbances. A lot of times when you eat a lot of sugar, think about, Thanksgiving meal. What do you want to do after you eat a bunch of potatoes and breads and all that kind of stuff, dessert? You want to crash. You go on the couch. You're tired. So if you're tired then and you're taking rest, how's that going to affect your sleep at night? It's going to make it irregular. I have a lot of people who have sugar spikes at nighttime and their cortisol goes up, and sometimes their sugar goes down and their cortisol goes up. So you can have these problems and it's going to cause people to wake up. Typically, I have people waking up at 3 o'clock. A lot of times it's because they ate it at 9 or 10 o'clock, and that's the way your body is working. It's processing that food that you eat late at nighttime. Number 5, anxiety. There's some studies out somewhere up northeast in the United States, but they've shown how food, especially sugar, can affect anxiety. If you have anxiety, a lot of times if you can control that up and down sugar, a lot of times it can really help your symptoms. The other thing is a lot of anxiety type medicines can actually make your sugar go up. So you want to be careful what kind of medicine that you're taking. Number 6, gout. Gout is something that we think about joint disease. A lot of times we think about eating too much meat, but also the fructose, that's a sign of having too much fructose. Now, fructose is half the sugar in really regular table sugar. So in table sugar, you got half glucose, you have half fructose, and the fructose is usually causing the problem with the uric acid. So I do a lot of testing for uric acid on almost everybody just to see if they have underlying metabolic disorders associated with fructose. 7, headaches. Headaches usually are from inflammation. They can be from other reasons as well, but inflammation can be a result of taking in too much sugar. And number 8, joint pains. There's something called advanced glycation end products. If you think about this, if you have joint pains, maybe you're taking in too much sugar, because what happens is that excess sugar, let's say you're a diabetic and your blood sugar is high, you take some medication, your blood sugar goes down. Where do you think that sugar goes? Unless it's some of the newer medicines that's out that makes you urinate sugar, that sugar is deposited somewhere in your body. And a lot of times the joints and tendons get these deposited sugar, and they can cause inflammation, and that causes some of the joint pains. And number 9, aging. What happens when you take excessive amount of sugar is you have what we call telomeres that are shortening. Now, telomeres are a sign of aging. We want longer telomeres, and the shorter they are, the quicker that we age. So these are some of the reasons why we really want to limit amount of sugar that you take in. So let's say that you identify you're hangry, you've got diabetes, you got high blood pressure, maybe you have some rashes, some eczema. What can you do about it? Well, you need to get off sugar. So I'm going to talk about simple tips for detoxing for sugar. Number 1, the first thing I want you to think about is I want you to think about the things you can eat, not the things you can't eat. It becomes a mindset issue. So if all you're thinking about is I can't eat sugar, can't have candy bar, can't have a pop, instead think about the things you can have. You can't have any kind of meat. You can have vegetables. You can have some fruit at this time as well too. So concentrate on the things you can eat, not the things you can't. And number 2, during this time when you're trying to detox sugar, don't worry about losing weight. That will come. You get off sugar, you're going to lose weight. So don't worry about how much you're eating and things like that. You can't chase 2 goals at one time. You can't try to get off sugar and you can't try to lose weight at the same time. Just concentrate right now, getting rid of the addiction, and then the weight issue will come later on. It's a process. Put first things first. And number 3, when you are going to quit, how many days is it going to take you to quit? Go ahead and set it in your mind. If you're going to quit in 5 days, say in 5 days, I'm getting off sugar. It may be 2 weeks. It may be a month. I wouldn't go more than that, of course. I try to do it in a short amount of time. Just like if you're trying to get off alcohol, you need to, or, drugs or smoking or whatever it may be, you need to get off. But set a time. Set a time. I'm going to be off sugar at this amount of time. Number 4, clean your cupboards out. You need to get rid of the temptations. It's just like if you were trying to quit smoking, you wouldn't leave packs of cigarettes sitting around around everywhere. You want to get rid of the temptations. Number 5, eat whole foods. When you eat whole foods, you're going to get the nutrients that you need. And when you have the nutrients, you're going to have less chances of breaking over because your nutrients that your body needs is going to be met. Number 6, avoid artificial sweeteners. This is just a trap. Sometimes we use this as a bridge to get from one place to the other, but we really need to concentrate on trying to eliminate the amount of artificial sweeteners that we hit. Number 7, recruit others to help you. Community is key. It's going to help you get to where you want to go. So when those times when you feel like going back to the ways you used to, if you're in a group setting, you're going to get more out of it. Number 8, don't quit if you have a setback. So let's say you're trying to do a detox. You're in it for 5 days. You're doing well. So then suddenly you eat a candy bar. You drink a pop. Don't quit. Just restart. You don't have to go all the way back to the beginning. You've come a long way. Just get back on the bike. Keep going. And number 9, add electrolytes. Now, I've tried to link something that we use here as far as the electrolytes that we use. So make sure you're getting enough fluids and electrolytes into your system. So those are some simple tips that you can get started to get off of sugar. Now, the one thing that we talked about at the beginning, we're going to have a detox here, and hopefully you're listening to this as it comes out. If not, we may be doing this later on, or if you need help after the fact, after we've done this challenge, and just reach out to us and we'll see what we can do to help you. But if you are interested in getting off sugar and you want to have a community and you want to be able to walk with other people during this time, sign up and we will get you on the list. You'll get some emails from me, and hopefully we'll have some Zoom calls so you can ask questions in case you need something at that time. But just think about with sugar, it's something that is detrimental to your health. It's kind of like a process of months and years of destroying your body from the inside out. So getting off sugar, you're going to feel better. You're going to have more energy. And I think that you'll be able to avoid a lot of the long-term complications that come with excessive sugar. All right, so let's talk about our catechisms today. Today, we're going to talk about what is the first commandment. And the first commandment is, you shall have no other God before me. So when we talk about God, a lot of times we want to just think of this magical person. It's not. It's a real person. It's there, and Jesus Christ is at the right hand of the Father right now. And we need to have him as the first and foremost authority, not our spouse, not ourselves, not what we think, not our government, no nothing. We have no God before him. And sometimes we put other things in front of him. We put our kids in front of him. We put, our spouses. We put our job. We put, our finances. So it's important that we have no other God before him. We trust and obey him, and he will direct our paths. He will lead the way that we need to go. So remember to join our Detox from Sugar Challenge. We look forward to meeting you there. If you have any questions, of course, reach out. Otherwise, we'll see you guys next week.
This podcast is for informational purposes only. No patient-provider relationship is implied or established. This podcast in no way represents the practice of medicine, and the information given is to be used at the listener's own risk. Please consult your provider before making any changes, as the contents of this podcast is no substitution for your provider's instruction.